So, hello everyone. Now we'll be talking about the fluid ringer lactate. So, ringer lactate is the most physiological fluid. Why? Because we talk about ringer lactate, we should know what is the composition of ringer lactate. So, ringer lactate contains a sodium content of around 130, potassium of 4, calcium of 2.7 milliequivalents, chloride of 109, and lactate of that. So, its composition and its osmolality is very equivalent to that of the plasma osmolality, which is around 285 to 295 milliequivalents per liter. So its composition is very similar to that. Ringer lactate is very similar to the plasma, and it is also called as the isotonic fluid. So we should know what is his mechanism is that ringer lactate normally it contains sodium, potassium, calcium, chloride. So rather than giving just the fluid, it also gives the supplements of potassium, calcium, which is equivalent to that of the plasma. An important thing is that in ringer lactate, there is amount of lactate is present. This lactate, even though it appears as that ringer lactate is lactic, so there can be increased supplement of lactate and patient can go into lactic acidosis, but does not happen that way. Usually, in normal patient or healthy patient, in the liver, lactate gets converted into bicarbonate in liver. So this bicarbonate is the anion, and thus this bicarbonate has role in decreasing the acidosis. So that's why ringer lactate has a benefit that in patients with mild to moderate acidosis or metabolic acidosis, ringer lactate is the ideal drug of choice, not because of the lactate as such, since because these lactates get converted into the bicarbonate and this bicarbonate has a role. So when we compare ringer lactate with the normal saline has a slightly higher sodium concentration and chloride as well, but it contains only both of them, and there is no other electrolytes like potassium, lactate, and calcium is not there in the in the normal saline. It contains only this one, and it has a osmolality of 308 milliosmoles, that is milliequivalents, which is slightly high when compared to that of the plasma. So coming to the mechanism, as we have discussed, one is the this ringer lactate is very much isotonic and similar to that. So a large amount of volume can be given. It restores the intravascular volume and improves the cardiac output and perfusion. Important thing is that it is isotonic nature. So since it is isotonic, there will be not much shift of fluid between the intravascular and the tissues. Supposing this is all tissues. So from tissues, the fluid will not go much inside and out as well. And majority of the fluid which you give, since because of isotonicity, it will remain into the circulation only. Other thing, as we discussed, lactate gets converted into bicarbonate in the liver, and thus this bicarbonate has a role in decreasing the mild to moderate metabolic acidosis. What are its indication? Patients with sorry, patient with severe hypovolemia, where patient needs a hydration, ringer lactate is the ideal fluid of choice. Also in the post-op patients, patient when they are dehydration, burns patient and fractures patient, ringer lactate is an ideal drug, ideal fluid of choice. Also in diarrhea. So in diarrhea, what happens is that patient loses potassium and there could be hypokalemia. So there is hypokalemic metabolic acidosis because in diarrhea, patient lose potassium as well as then patient loses the bicarbonate as well. So now what happens is that to counteract this hypokalemia, ringer lactate has the potassium in it. So it is that's why useful in these patients. And also lactate gets converted into bicarbonate and that bicarbonate can counteract this acidosis as well. So ideal food of choice if somebody asks you in diarrhea is definitely ringer lactate because of it's mainly because of the potassium content. So let's talk about the contraindication. We'll go in one by one. Suppose a patient is having severe hypoxia and shock. So what will happen? Suppose this is the liver and patient is in shock and suppose patient is this liver is receiving supply from the heart from here and there. And suppose patient is in hypoxia and severe shock. So in during shock, what happens is body tries to save the organ which is most important, that is the brain and the kidneys. And there is in during shock there is decreased perfusion to the liver. So when there is decreased perfusion to the liver, the activity of the liver also decreases. So now what will happen is now is if the liver is not functioning properly, this lactate will not get converted into bicarbonate. So this pathway is blocked here. Bicarbonate. So this will lead to what will happen is the lactic acidosis. So more lactate will accumulate and lead to lactic acidosis. Similarly, in patient with liver disease where liver is not functioning, this lactate to bicarbonate is conversion will not happen and it will lead to lactic acidosis again. Also, in patients with severe metabolic acidosis, due to the severe acidosis also, there is the decreased response of all the organs. In severe acidosis, what happens is all the organs functions is very much reduced. Functions is reduced due to severe metabolic acidosis. Next is in during vomiting. So we'll discuss about this vomiting now. What happens during vomiting is that our gastric contains lot of acid. Okay, there is HCl is present in the this. So whenever the vomiting happens, this H plus and Cl is H plus is lost. Lot of acid is lost here. So what will happen is that it will lead to a condition called as metabolic alkalosis. The two, it is hypochloremic metabolic alkalosis because both H plus and Cl is lost here. So acid there will be because of the loss of the acid there will be alkalosis and because of the loss of the chloride there will be hypochloremia. So hypochloremic metabolic acid alkalosis will be there in vomiting. And as we all know, ringer lactate contains the lactate which gets converted into bicarbonate. So bicarbonate if you give to this patient it can increase the alkalosis. So in vomiting this is not the ideal drug. Ideal food of choice in vomiting is normal saline. There is 0.9% NS. Why? Because it contains chloride, which will compensate this hypochloremia. So whenever the chloride is normal, once the hypochloremia is now controlled, what will happen is that now excess of bicarbonate will be lost from the kidneys, and thus metabolic alkalosis will be reversed. Last contraindication is the blood transfusion. So blood transfusion, simultaneous giving of blood transfusion and ringer lactate through the same line is contraindicated because ringer lactate contains the calcium. This calcium binds with the citrate in blood and inhibits its activity. This citrate is basically nothing but is an anticoagulant. So if you give blood and ringer lactate both in the same line, there will be reaction and this citrate activity is reduced and thus there can be increased clotting of the blood. So that's why these are all the contraindications, that is hypoxia, liver disease, metabolic acidosis, vomiting and blood transfusion. Thank you.